So good afternoon, namaste. Thank you for the opportunity to present today. My name is Jessie Janssen. I am a researcher and lecturer at the IMC University of Applied Sciences in Krems, Austria. Today, my esteemed colleague, Professor Dr. Gerd Tucek, was going to present, but due to personal circumstances, he wasn't able to. But we've worked on an empathy project together, and he asked me to do the presentation today. A little bit more background about myself. I've studied physiotherapy, but afterwards I've done a master's of Biomedical Health Sciences, really went into the area of research, and then did my PhD in building clinical capacity, research capacity in New Zealand. So I've been broadening my scope outside of physiotherapy more towards allied health professionals. Right, so the project that I want to talk to you about today is empathy. It's part of a bigger project that we've done, which was the Josef Ressel Center here in Austria. It was funded by the Christian Doppel Forschungsgesellschaft, and the scope of the research was to broaden the horizons of personalized music therapy. And the project consisted of 3 different parts. So there was some people who were looking at the right period, some people at the right moment, and some at empathy. I'll go into detail about the empathy. I just want to introduce the other 2 topics really briefly. The right period project was looking at when was the right time to offer therapy to a patient within a rehabilitation setting. So would it be the morning? Would it be the afternoon? Would it be when people are very tired? Would that be the right moment? Or how do we know this as clinicians or therapists? How can we help them? So that was looking at the right period to give people treatment. The second one is the right moment project. So in the right moment project, it was really looking in depth at those special moments when 2 people, a patient and a clinician, come together and they share a special moment. So they have this click and you think, yes, at this moment in time, we are really together. And what's happening there? So that was what that research project looked at, really in depth about what's going on. So that was a really interesting project as well. The last project was about empathy, where we looked at how can we measure empathy, how can we train people to be more empathic and also take care of themselves, be empathic towards themselves. So those were the 3 different projects within the horizons of personalized music therapy. As I said, I'll go a little bit more into detail about the empathy. And there are very many different definitions of what empathy is. The one that we've used is, and I'll just read the definition that's at the bottom here. It's the ability to share someone else's feelings or experiences by imagining what it would be like to be in that person's situation. So being able to share that emotion that person is feeling, that you feel it yourself. Why is this important? You probably all know this, but this is important because it really is vital for the patient-clinician relationship. And there has been done some research into it, and patients are more satisfied when they feel that the clinician is more empathic, but also fewer mistakes are being made. Patients adhere to medications better, and there were fewer malpractice cases. So it definitely has a win-win effect on being more empathic. But it's sometimes hard to stay empathic over a long period of time, and that's what we were looking at. Can we measure changes in empathy? Just before I go into what exactly we've done, I just want to touch on the notion of compassion. Because it's related to empathy, and the way we've defined this in our study is that you have the empathy to notice that someone else is feeling is feeling something, that you feel it yourself. But the additional thing in compassion is that you're doing something to reduce or prevent this, so also act on it. That was the difference for us between compassion and empathy. Right. So overall, we had this goal to develop a curriculum where empathy and compassion are taught, so that when the clinician or when the students are finished, they can be self-empathic, so they can guard themselves, but they still can be empathic towards others and act on that empathy with compassion. So that was the original goal. We didn't quite get there. The good news is we got some additional funding, and now we are actually looking at developing that curriculum and training for students within the curriculum towards empathy and compassion. What we did find is that there were a few hills in the way, hills, mountains, depending on the challenge that you see. So today I just wanted to share a little bit about the path that we took in the 4 different domains. So the first hill that we had was, okay, what can we actually use to evoke an empathic response? Is there something that's being used a lot because we didn't notice? And I'll tell you what we found. The second hill was, can we measure an empathic response objectively? So if we have something that evokes an empathic response, can we also measure it objectively, not just with questionnaires? Then the third one, can we measure a change in empathy? So if we want to do a training, if we need to know if it helps or not, we need to look beforehand and afterwards and see if there is a difference. But then we need to be able to measure a change in empathy. So that was what that research question was about. And then the last one was, what could an empathy training look like? So what sort of training could we do with our students and perhaps clinicians? So I'll guide you through these 4 different topics that we've looked at. The first one is, what can we use to elicit an empathic response? So if you look in the literature, there has been quite a bit of research done on positive and negative emotions with films. So they've given a film and then they looked, is this a positive film or a negative film? So not quite the focus that we had, because we are looking at empathy. And there wasn't anything out there that really specifically also correlates this to empathy. In addition, the movies that they used were normally quite well-known movies that people might have seen a few times beforehand. So we actually wanted a new movie or film that we wanted to use. So we found one, which was the film Removed. It's a negative film or a negative response film, where it's about a little girl who who's being abused at home and then is moved from foster care to the different places. And yeah, it's not going well. So it definitely has a negative emotion to it. Towards the end, it slightly changes and it becomes a bit more positive. So we've taken that out because we wanted to stay with that negative emotion. And we wanted to see, can the people who see this film, are they feeling empathic towards this person, and what are the changes with that? So we did a research question where we got some demographics like age and gender, and then they saw the film or the control film. So the control film was a film where someone talked about this holiday in the mountains, walking somewhere. So they either started with the empathy film or they either started with the control film. And then a week later, they did the same thing. Then the questionnaire was, we had the PANAS and the IRI, which the PANAS is looking at positive and negative emotions. And the IRI is really looking, that is the interpersonal reactivity index, is really looking at empathy. And we wanted to see what sort of emotions are there and what's the relation to empathy. So what we found was that with the PANAS, the positive, so the bigger emotions, that the control film was significantly more positive than the empathy film, and the empathy film was significantly more negative, which is what we would have expected. However, what we also found was that the negative aspect was also correlated to the empathy score. So that gave us an idea that the film was also evoking an empathic response. So we've published this in 2020. So if you want to go into more detail about what we've done, please have a look at one of our articles that we've written about it. So we had a film that evoked an empathic response. Then the second question was, can we measure an empathic response objectively? So in this situation, we've used biomarkers from saliva samples, and in this case, we worked together with the University of Applied Sciences in Tyrol, also in Austria. They've analyzed the saliva samples for us to see, okay, is there a difference in saliva, in biomarkers when they look at control film or at the empathic film. We also looked at heart rate variability to see if there is a difference between the empathic film and the control film. We did exactly the same thing as what we've done with the previous project. So, but we had more people. So we had 61 people in this particular project. One group started with the control film, and a week later they saw the empathic film. Another group started with the empathy film, and then a week later they had the control film. We tried to standardize some aspects, so the same time when they did it, what they ate, what they drank beforehand, that was similar between the 2 days, because that has an effect on biomarkers. If you go into more depth about what exactly we've done, they gave some, we gave them some questionnaires. Apologies, this is in German, but I'll guide you through it. So this is some questionnaires. Then they got the saliva sample. They saw one of the two films. They had saliva samples again, questionnaires, and then one more saliva sample. The heart rate variability was throughout that whole time it was measured, and we took 5-minute breaks out of this. So beforehand, during, and afterwards, to see what's happening with the heart rate variability. So what we found was that same as in the previous study, so it's good that we have a similar response, that the control film was significantly more positive than the empathy film, and that the empathy film was significantly more negative than the control film. So that was exactly similar. So that was a good finding for us. Then we looked at the biomarkers, and we saw that in the empathy film, 4 biomarkers were actually changed significantly compared to the control film. So we had alpha amylase, estradiol, IgA, and interleukin beta. Those 4 significantly changed in the emotional film or in the empathy film compared to the control film. So we that was at least an objective finding that we had. What exactly it meant, we weren't quite sure yet. I'll go into this a little bit later. Also, we looked at the heart rate variability. In the heart rate variability, we looked at quite a few different variables. The only thing that was different was the standard deviation of the heart rate. So actually the variability of the heart rate. And we saw that in the empathy film, there was more variability than in the control film. Again, what that means is in the next phase. We've published this as well in scientific reports. So if you're interested more into the objective findings of this film, please have a look at this particular research. So at this moment, we knew that we had a film that we could use to evoke an empathic response, and we knew that also objectively we could see some significant differences. So what we then did was actually see if we could measure a change using the same film. So we had one group who looked at the removed film, And then a week later, they looked at the removed film again. And we wanted to see if there are any differences if we measure twice. So we had 31 people in this particular study. So that was all students. Same as before, we had questionnaires in the beginning, then we had the saliva sample, then the film was showed, then we had questionnaires, and we had saliva samples again. If you remember, in the previous one, we had some saliva samples here as well. We left those out because that response was too quickly and we didn't see anything meaningful. So we found that actually to take saliva samples at a later stage, it would actually give us more information. And again, we had heart rate variability throughout the whole time, where we took those 3 times blocks that I talked about previously. So ideally, we wouldn't want to see any significant differences between the 2 films because it's exactly the same film. And unfortunately, the results were that yes, there are differences if you look at a film twice, which does make sense in a clinical situation, but we would have hoped that this short film was emotional enough that the responses would be similar, which unfortunately it wasn't. So in the questionnaires, we saw that there was significant different response in emotions, so in the positive and the negative emotions, which means that you can't use the questionnaires as a tool to measure the change. And the film probably not as a tool to measure the change. Also, in the heart rate variability, we saw significant differences in the outcomes between the same film when they saw it twice. In the biomarkers, there weren't any significant differences, so we thought perhaps there's something which we could look at, but the correlations between the biomarkers in the first film and in the second film were very low. So actually the results of this particular study meant that you can't use one film to evoke the same response twice, which was unfortunate. And we are in the process of trying to publish this, but because of publication bias, it's a bit more difficult to get this out there. But we are still trying. So that was the third one. So then we sort of knew, okay, we've got a film that evokes an empathic response, but that response isn't similar if you use it twice, and maybe not 3 times as well. We don't know this. We were still on course though, because we wanted to also look at the training effects of empathy course. So we worked together with a rehabilitation unit in Austria, where we worked together with the staff there. So these were not students anymore. And we looked to see what the effects were if there was a self-compassion course of 8 weeks. What were the effects on empathy and compassion? So we gave them the same sort of things that we did in the other studies, so the heart rate variability, the saliva samples, and the questionnaires before the course started, and we did it 8 weeks after. So when the course was finished, we did the same thing again. We've only analyzed the questionnaires because at this point we knew that we couldn't use the heart rate variability and the saliva samples. But what we've also done is after 3 months, so after the course was finished and 3 months after the course was finished, we did a focus group, and we've really looked at what do these people learn from this particular course, and what do we need to know about this. So I won't present everything because I'm running out of time, but I just want to leave you with a quote from the focus group, one of the participants in the focus group, as what the effect was of this particular course. And this is the following one. So if there is a situation where I was perhaps angry because I didn't succeed in something, and then I immediately stopped because I realized, okay, why am I angry now? And immediately I went away from this anger and towards this compassion with myself and allowing myself to do that. And that has a very big influence, because just this getting angry and then getting stuck suddenly fell away. Because the moment I realized that, at that moment, I shortened it to 1 minute, where else I would have spent much, much longer in this situation. So hopefully this gives you an idea that the actual self-compassion course that we run really helps the people in this course and in this research project. And as I said, we are now working in a next stage to see if we can implement some of this with our students within the curriculum. It's now still a research project, but we want to, if we are successful, we want to actually build this within the curriculum, so we in the longer term will have clinicians who are being trained on being self-compassionate and empathic towards others. Right, thank you. That's the end of the presentation. So thank you for your attention. I normally always ask, are there any questions? So if you have any questions, my email address is listed here. So send me an email and see if you want to have a chat over the research projects that we've done, or if you have any questions that weren't quite clear, then I'm happy to answer any emails or set up a meeting that we can have a chat. So the last thing I can tell you is I hope you have a wonderful rest of your conference, and hoping to hear from you if you have any questions or any remarks. Thank you very much, and hopefully see you in person next time. Okay, bye-bye.